Hi, this is Barbara Fischler, and I'm presenting my idea, eye protection for patients in the PACU. The healthcare problem in need of a solution in this case is with postoperative adult patients in the post-anesthesia care unit. They often rub their eyes repeatedly while waking up. Patients do not tend to recall directions in this early stage and to not do this, and RNs must frequently intervene in such cases. Rubbing the eyes can result in a corneal abrasion, which is quite painful. Some patients will even report that it is worse than their surgical pain. This can also lead to additional ophthalmology consultation and care. So in this case, the antecedents or contributing factors to the problem include, a patient emerging from general anesthesia, nurses providing care for multiple patients, moving from, bedside to bedside. The consequences include cases of corneal abrasion with increased postoperative pain for the patient, increased costs associated with that, additional care. It can also require nurses to guard against the patients from rubbing their eyes, which reduces their ability to provide care for other patients. The proposed innovation to address this problem is to apply protective eyewear like plastic safety glasses to the patients. The glasses will shield the eyes from rubbing. A trial of safety glasses would be conducted to determine the best design, and that would be in a pilot study. An existing product would be used initially, and if needed, a custom product would be developed with a manufacturer of safety glasses. So this is an example of von Hippel's user-driven innovation. The user, in this case the RN, has the most information about their unmet needs and will innovate to develop a solution. Diffusion of this innovation would initially occur via face-to-face communication in the institutional patient care setting, which in this case is the PACU. The staff could conduct a study and publish results in a journal, which would be an example of further diffusion through mass media communication. To evaluate this, a use case illustrates the role of this innovation. An adult patient would receive teaching about the glasses prior to surgery. Safety glasses would be applied to the patient upon arrival to the PACU in addition to all other monitoring equipment. The glasses would protect the patient from incidental eye rubbing while they are sedated and recovering from anesthesia. The glasses would also provide an additional safeguard if the RN is not at the bedside. The safety glasses would then be removed by the RN when the patient is sufficiently recovered and mentating appropriately. The glasses would be wiped down with disinfectant and reused, as is done with the other monitoring equipment. This innovation can improve safety, reducing patient-induced corneal abrasions. Here is my list of references, and thank you for listening to my presentation.